going to be doing a training on FBAs, functional behavior assessments. We're going to talk a little bit about what an FBA should look like, what is included in an FBA, the assessments that you'll be running with your client, as well as kind of the first steps you should take and going on after the first observation, what you should be doing. I'll stop at some of the slides and answer questions, and I'll also talk about some of the most frequently asked questions, and hopefully those will answer any questions you do already have. So what is a functional behavior assessment? What's an FBA? It's a functional assessment in order to figure out what is causing a child to engage in a certain type of behavior. It uses a variety of techniques to understand what is behind inappropriate behaviors, and it includes looking at non-academic factors that may be contributing to the child's behavior. So you're looking at the environment majority of the time and trying to see if anything in the environment is an antecedent to that child's behavior. As the evaluator, you're going to be assessing not only behaviors, but as well as the child's skills in these other areas such as communication and language, social skills, adaptive skills, community, safety. You're going to be assessing motor skills, fine, gross. Now, I know sometimes some individuals are a little confused by an FA and an FBA. So an FA may be part of an FBA, but a functional analysis is only a possible component of an FBA. And this is a more in-depth analysis of a particular behavior to really prove why the behavior is happening. You're trying to identify the exact function, and you create 4 conditions to look at the behavior. So the alone, and this is when you're trying to figure out if the behavior is automatic, if the child is engaging in the behavior for attention, to escape, or for access to tangibles. FAs are difficult to run and they're lengthy. So if you ever do feel that you're having a difficult time identifying the function of a particular behavior that your client is engaging in, and you really think that it would be effective to run an FA, make sure that you have either the experience to do it and you feel confident to do it on your own, and if not, that you reach out to somebody who has done an FA before so that you know you're conducting it the right way and you are targeting very pivotal parts of an FA. Now, here at Proof, how do you get started for an FBA? Well, at first you're going to receive an email from Heather Grimaldi, and she'll assign you an FBA, and that will have the authorization attached to it. It'll have the client's name, it'll have the family name, either mom or dad, it'll have their contact information, date of birth, as well as the address. And once you receive this email, your first step is to call the family. So you want to call the family within 24 hours of receiving the email, and you want to schedule your first observation with them. Introduce yourself, let them know who you are, let them know where you're calling from, what agency you work with, and you want to come out and set up the first observation. They'll let you know as soon as the family confirms the first appointment. You'll email Heather back to let them know when your first observation will be. So after that, you want to pick up a client service agreement from the office, and the CSAs are in the, as soon as you walk in to the office, that the shelves all the way in the back in the black bins, you'll see the CSAs in there. There's English ones, there's ones in Spanish as well. And make sure that when you pick up the client service agreement, you take the paperwork out and look through it. Make sure everything is in there. The client service agreement will definitely have to be in there, and as well as the HIPAA rights, and there's a welcome letter, there's a release of information form. So you make sure all of those things are in there, because those are things that the parents are going to have to fill out and sign, and you're going to have to submit those signed documents to Heather when you submit the finalized FBA. Also, the CSAs include the Day C2, which is one of the assessments, and we'll talk about that a little later. And they include the FAST, which is another assessment. However, for LA Care, they don't want the FAST. They want the Vineland, the VB-MAP, and they want the MOS, which is a motivational assessment scale. So those ones are not always in the CSAs, but they are in the back in one of the resource binders. So if you don't have access to those assessments already, make sure you go and take the original copy out and make some copies for you to take. And it's good to just have one. And again, if you've never conducted those assessments before, make sure you read through them and ask questions. Ask other supervisors who maybe already have conducted them so that you know that you're doing this the right way. So once you've got the packet and you've looked through the CSA and you're familiarized with it, you want to choose the assessments you're going to use. So we're going to talk about all of these assessments a little more in depth. We're going to talk about the Functional Assessment Screening Tool, or the FAST, and this one is the most commonly used one. We're going to talk about the Motivational Assessment Scale, or the MOS, the Vineland Adaptive Behavior Scale, the Verbal Behavioral Milestone Assessments and Placement Program, and this is the VB-MAP, and the Developmental Assessment of Young Children, which is the Day C2. So for the FAST, this assessment is easy to conduct. It identifies factors that may influence problem behaviors. It serves as a comprehensive functional analysis of the behavior. And the questions or the items are organized into 4 functional categories based on the contingencies that maintain the problem behavior that you're talking about. So for this one, you can fill it out with the parent or have the parent or caregiver fill it out. However, I've found that oftentimes when you leave paperwork behind in the home and ask the family to fill it out and then come back, they've misplaced it, or they forgot to fill it out, or they were really confused because some of the questions they seem a little tricky. And so it's okay to just, the very first meeting, just say, hey, we're going to fill this out really quickly. And you ask the questions to the parents. Sometimes, again, like I said, the questions aren't very clear to them, so it might be good to explain them. So it's a good idea just to help them fill it out, and that way you know for sure you're going to have this before you leave. The FAST just asks questions. So when you're filling this out with parents, make sure that you use one FAST assessment per behavior. So if you're targeting hand flapping, and you're only going to be filling out the FAST for hand flapping, so you're not going to be talking about any other behaviors. If the child is engaging in other behaviors such as head banging, then you would fill out a separate one for head banging and so forth. So the MOS, this is a questionnaire designed to identify those situations in which an individual is likely to behave in certain ways. The CSA that we have here at the office has a shorter version of the MOS, which is still, it's valid, it's a reliable assessment. However, for LA Care, they have a different version of the MOS, and their version has 57 questions on it, whereas the one that's in the CSA only has, I believe it's 12 questions. For LA Care, they want the one with 57 questions. And if you do get an FBA for LA Care, when you get that template for their FBAs, the MOS is attached to there. But again, if you don't have access to it, or if you just want to have it as a resource, it's in one of the resource binders in the back for the training on FBA for this training. And for this one, similar to the FAST, it has questions. However, the FAST is just yes or no, and the MOS it's a scale. So 0, the child never engages in the behavior under that condition. 6, always. 3, seldom or half the time. So it's a little bit different, and they're scored differently. So for this one, the same as a FAST, you identify one behavior that you're going to target, and you want to identify the behavior specifically. So instead of just saying SIB, you would write head banging or punch yourself in face. Or instead of aggression, you would write in kicks or bites or punches. You want to be very specific. And for this one, again, you're filling it out based on observation, and you're talking to parents to answer these questions. Now, the Vineland. This one is one that LA Care definitely wants to use, and it's not used all the time for other FBAs, but if you're doing LA Care, you're definitely going to be using the Vineland, so you do want to be familiar with it. And the focus of this assessment is the measurement of the adaptive behaviors of the client, including their ability to cope with environmental changes and to learn everyday skills to demonstrate independence. And the Vineland is broken up into different domains. So there's the communication domain, and here it's focusing on receptive and expressive language and written communication. The other domain is daily living skills, so domestic and community interaction, dressing, bathing, washing face, washing hands, blowing nose, things like that. There's a socialization domain, and here it's looking at play, leisure time, interpersonal relationships, as well as various coping skills. So do they have friends? Do they go out with friends? Do they make plans with friends? Do they talk to people on the phone other than familiar people? It's looking at those things. There's the motor skills domain, and this is gross and fine motor. So it'll ask questions such as whether or not the client has the ability to button and unbutton large buttons, small buttons, if they can zip and unzip, clip the zippers. And those are some of the things that these domains will look at. Tying shoelaces. The VB map is also another that is not always used, but LA Care is fond of this one. So if you get LA Care FBAs, you'll most likely be conducting this assessment. And this one is based on Skinner's analysis of verbal behavior, established developmental milestones, and research from the field of behavior analysis. And what this one does is it provides a baseline of performance, a direction for intervention, system for tracking skill acquisition, and a tool for outcome measures, as well as framework for curriculum planning. And as I'm going through these assessments, you guys will see we provided the packet that we provided to you has a copy of each one of these assessments except for the VB map. And this is something that if you do want access to, we can email you, or you can ask another supervisor if they have access to it, and they can email it to you. We're going to try to add it to the Dropbox so that way other supervisors have access to it now that we are doing more LA Care FBAs. And the VB map is also broken up into components. So I'm sure you guys are starting to see a pattern that all of these assessments are broken up. And the reason is because, as I mentioned earlier, you're not only looking at behavior, you're looking at all these other different domains in the child's life. You're looking at communication, you're looking at their daily living skills, because the ultimate goal for our clients is for them to become functionally independent and to live a typical life as closely as they can. So we want to assess all of these different domains to make sure that we're doing everything we can to get them to that ultimate goal. So the first component for the VB map is the milestone assessments. So this part provides a sample of the client's existing verbal and related skills. And then I've listed here the skills that are assessed, and I won't read all of them off because it's quite a few, but definitely look through this PowerPoint and look at all of the different areas that are assessed. For the communication and language part, you're looking at manding, tacting, echoing, intraverbal, answering WH questions, listener, motor imitation, independent play. So those are some of the areas that you're looking at there. And for the VB map barriers assessment, that's the second component. This part provides an assessment of 24 common learning and language acquisition barriers that are potentially faced by our clients with ASD or other developmental disabilities. And so this component of the assessment includes behavior problems, instructional control, defective MANs, defective TACs, defective echoic. So it's kind of going off of the milestone assessments and how the milestone assessments, areas that are assessed, can potentially become barriers. And again, I've listed all of those there. I won't read all of them off specifically, but you kind of get an idea of these areas that become barriers a lot of the times, or potentially may become barriers. The third component of the VB map is transition assessment. And this one contains 18 assessment areas which help identify whether a child is making progress and has acquired the skills that are necessary for learning in a less restrictive environment. Again, I've included the measure of the first two components as well as negative behaviors, and these are the areas that are assessed: classroom routines and group skills, social skills, academic independence, generalization, variation of reinforcers, the rate of skill acquisition, retention. So you're looking at a lot of what the child or what the client can and cannot do, and how those things will either enable or inhibit their progress. The fourth component is the task analysis and skills. We're all familiarized with task analysis, and we all know that they provide a more extensive breakdown of skills. There's task analysis for tying shoes, brushing teeth, bathing, toileting routines. There's for multiple skills. And so the task analysis section serves as an ongoing curriculum guide as well as ongoing learning. And TAs are important in that they begin to move the child's repertoire to that of a more typically developing child. A lot of the times our clients aren't independently able to develop these skills unless they're broken down. So oftentimes for us, brushing our teeth it's just part of our daily routine. So we know we grab the toothbrush, the toothpaste, we put the toothpaste on the brush, we rinse, we put everything away. So that's just something we've learned, right? Nobody really had to, possibly most likely didn't have to provide us with visuals or too much instruction before it became just part of our routine. However, for our kids, it's not always like that. And so they need these skills to be broken down into steps, and oftentimes we have to teach them steps, one step at a time, instead of, okay, here's 5 steps to brush your teeth, go. It's no, we're working on the first step and making sure that they're independently completing the first step and then moving on until they independently brush their teeth, and then we fade out those prompts, those visual prompts and those verbal prompts. The fifth component is placement and IEP goals. As behavior analysts, we don't have much of a role in IEP goals where we don't do anything academic. Our role is behavioral. And so this section doesn't apply too much to our field, but it does help balance out an intervention program. When you go out and do FBAs, sometimes the family will provide you the most recent IEP. And when they give you that IEP, go through it, read through the child's goals, because a lot of the times some of the goals that they're working or targeting at the school are goals that are similar to the goals the child has with us. And sometimes it's good to see what prompts the child has at school and the progress they're making at school, because there have been times that the child has met or very close to meeting an IEP goal, and that goal is very similar to a goal that you have for that client, and they're not making any progress. So that's when it's a good idea to collaborate with the school if they're open to and willing to do that with us. The Day C2. This one is in the CSA, it's in that packet. But again, if you do want just a copy to have for yourself, it's in the resource binder in the back supervision room. And this one is an assessment used to identify children with possible delays in the areas of communication, cognition, social emotional development, physical development, and adaptive behavior. With the Day C2, all of these domains I just mentioned can be assessed independently. For example, if you have a child that you don't think, or from observation, parent report, doesn't seem that he really has serious and socially significant delays in any one of these areas, physical development, for example. So you say, I don't really want to assess physical development, you can just assess the other domains. Or if you only want to assess one domain due to limited time, or that's the only one that you really want to focus on for now, you can only assess social emotional development, or you can only assess communication. So it's kind of nice with this. You don't have to run the entire assessment. You can do just one part of it. And it can be administered through observation of the child in the natural environment, during a structured interview with parents, or a direct assessment of the child. And it's a good idea to do this, a little bit of this, in all of those 3 scenarios or situations. You'll find that a lot of the times, if you read these questions off to parents or these situations off to parents, they'll say, yes, they can do it, or no, they can't do it. And the DAISY 2, it's 0 if they don't do it, they can't do it, or 1 if yes, they do it. And so often I've seen that parents will say, yes, they can do it, and then I go and I probe that, and the child is not able to do it. Or they'll say, no, they can't, and I'll probe it, and the child is actually able to do it. So it's just a good idea to, if parents say, oh, well, sometimes, or I'm not really sure, just directly assess the child and set up a scenario, or set up an opportunity, create an opportunity for the child to potentially engage in that activity to see if they can or cannot do whatever it is that you're looking for. For the DAISY 2, you'll see you have a copy, so if you could get that out and look through that really quick. At the very front page of every domain, of every area, it has a chronological age box. So when you're administering this one, you have to identify the client's chronological age in months. And the DAISY 2 typically is used for children up to the age of 5. So you're not going to be using this assessment if you're out assessing a 16-year-old client or an 11-year-old client, typically. So again, earlier, I remember we had talked a little bit about these assessments and when do you know to use them, or how do you know which one to use. This one, if you have a young kid, if you know you're doing an assessment for a little guy, 2, 3-year-old, 4-year-old, 5-year-old, most likely you're going to want to use the DAISY 2. If you know you're assessing an older kid, don't worry about bringing this. You're not going to have to use it. The other ones that we've mentioned earlier, the Vineland and the VB map, can be used for kids 0 to up to 16 years old or older than 16. So those are used more often because there's a larger age group that they can be used with. So for the DAISY 2, you want to identify the child's chronological age, and this will let you know where to begin the assessment. So if you see there are questions and they're all numbered in each area. So for example, if your child is 50 months old, you would start at whatever number it tells you right there. So 50 months to, or 45 to 50 months, this is where you start. You go to that number, and for this one, you want to establish the basal and the ceiling. So there's a separate PowerPoint also in the resource finder to kind of help you administer the DAISY 2 if you never have, but at the top it gives you a quick instructions of how to run it, and it's pretty simple. So if the child you start at the chronological age. If the child receives 3 consecutive zeros, then you go up. So you're going to start assessing at a younger age, right? Because you started at their chronological age and they just got 3 zeros, so you're going to go back up. You're going to back up a little bit. Or if you start at their chronological age and they get 1110, 110000, that's where you're going to stop, right? And then you're going to go back up. So you want to make sure that you're getting the best assessment by following those instructions. So we're going to talk about now the actual observations and what you're going to be doing. So for the first observation, you want to review the documents in the CSA with the parent and the caregiver, and you want to have them signed everything that's in there, because as mentioned earlier, you're going to have to turn that in to Heather when you submit your final FBA, your typed up FBA. And you're going to review any documents that parents have you look at. IEP, medical documents, progress reports from other providers. And so when you're looking through these, it's a good idea to take notes on some of these things. So if they do provide you with the IEP, again, look at the goals and write down what the school is working on with your client. And you can submit that information, type that information into your report. Because your FBAs, you want to make sure that they're as detailed as possible, because if you're not going to be the supervisor on the case and somebody else is going to be taking over on this case, you want that supervisor to be able to read through your FBA and have a pretty clear idea or understanding about the client before they even go out to meet them. And just to have a good idea about the family as well, because that's information you're going to also include in your FBA. If you're looking at medical documents, again, read through that. If there's anything that's significant, have they had significant medical history? Are they allergic to anything? Those are things that you're definitely going to write in your FBA, because you want the team that's going to come in to be fully aware of the client. I've had FBAs where the parents will provide me medical documents and the client is severely allergic to peanuts or to eggs. And I've had those situations. So it would be good if you have a kid that you know is allergic to peanuts to write that in, so that the staff doesn't come in with peanuts, because you don't want to have those emergency situations if you can avoid them as much as possible. Sometimes you're going in to conduct FBAs with the client families who have already had ABA in the past and are no longer receiving it or transitioning to proof from another agency. If they have the progress report from the other agency or any other provider, if they have speech and language from an outside company, or if they're receiving OT, those are all documents. If the parents give you access to, definitely look through them and write about that stuff in your report. Under the section of documents reviewed, you would write IEP and write a short paragraph about the IEP, medical documents, same thing, progress reports, etc. Also, you want to talk to them about what ABA sessions are going to look like. You're going to meet families that have had experience with ABA in the past, and you're also going to meet families who have no idea what ABA is and who have just received the diagnosis maybe 3 months prior to you being there. And so a lot of these families are still coping and they're still trying to understand all of these changes and what's going on. So you want to be as sensitive as possible, and you want to make sure that you come in with a professional approach, and you want to explain to them as much as possible what ABA is so that they're not feeling confused or lost. And you don't want to stress them out. They're already going through difficult times. If it is a brand new family, even if it's not, it's still difficult. And so you want to make sure that they understand what is happening, what ABA is going to be. Let them know what the clinical team consists of. There's a supervisor, there's a paraconsultant, and there's a direct one-on-one therapist. Let them know that there are some cases where there are 2 supervisors, a co-sup and a BCBA. There are 2 therapists. It depends. Every team is different, but just let parents know so that they have an idea of what to expect and how many people they're going to be seeing in their home. Let them know that a binder will be in the home and what's included inside the binder. And also, typically at the onset of services, the supervisor will do this, but it's good just to kind of prime them so that they have an idea, again, of what to expect from us. Let them know that data is taken every session, and let them know that with the FBA, there will be goals and there will be behavioral targets that we will be focusing on. And that's based on your observation, their interview, and it's going to address everything the client truly needs. Another thing, sometimes families don't really know why you're there. They know that you are there to observe their child. They know that you are there to conduct some kind of an assessment, but they don't know what you're looking for. They have their concerns. They know what they want for their child to be able to do, or they know what they want their child to stop doing, but they don't know how that's going to happen all the time. So make sure that they know why you're there. Ask them if they have had ABA. If they say no, let them know why you're there. You're going to be looking at behaviors. Explain why you're looking at behaviors, why it's so important that we target those sections first. Let them know you're also looking at communication and language. You're looking at their social skills. You're looking at their adaptive living skills. You're looking at their skills when they're out in the community. Are they aware of safety? Things like that. And also, we have now a workshop for families that are brand new to ABA. And so if you do have a family that is brand new, they don't know what autism is, their child is just diagnosed, they don't know what ABA is, let them know about that workshop and ask them if they'd be interested. And right now the workshop is only for monolinguals. However, if you do have Spanish-speaking families that would be interested, let one of the coordinators know. I believe Renee is the one who set up this workshop, so reaching out to her to let her know you have families who are Spanish-speaking that are interested, and then hopefully eventually being able to also create a workshop for Spanish-speaking families. But just really, really make sure that they know why you're there. Explain to them. Also let them know that ABA is, we're going to try our best, and we're going to make their child the best version of themselves. A lot of the times, your first observation, parents will start asking you those really difficult questions. How long will he have to have services? And is he going to be able to talk? And is he going to be able to do this? And those are really tricky questions, right? And we don't ever want to give parents false hope, but then we also don't want to crush their hopes. So a lot of the times, actually all the time, when parents ask me those difficult questions, I always say, we are going to make your child the best version of themselves. And that means that they are going to be the best that they can be. It's difficult. It's difficult to say, oh yes, they're going to talk. A lot of the times parents will ask you, how do you think they did? Or what did you see based on your observation and your experience? Do you think he'll be okay? Do you think he'll be able to talk? Again, don't directly ever answer those questions. Just go back to, we're going to make your child the best version, and this is our focus, and we're here to give him or her as much support as they need in order to become independent. Also, let them know that things do get difficult. Sometimes, very often, we face extinction burst, and let parents know there are going to be times that it might be frustrating for you, and you might feel that your child isn't making progress. Trust your clinical team. If you have concerns, communicate that to your clinical team. Let them know what you don't think is working, or if there's any kind of changes that you would like to see, so that the parent is happy. And we care about these families, and we want them to know that we care about them. We care about their child. So just make them very aware as possible. So after you're done reviewing those documents and signing the fun paperwork, you want to talk about the concerns. And what are the behavioral concerns? Ask them what they see, what it looks like, how often the behavior occurs, and be careful not to ask why, because that's why you're there. Don't ask parents, why do you think that happens? Or why does he tantrum? They don't know why. That's why we're there to help them. We're trying to figure that out. And we're going to implement an intervention to help answer that question of why and make it better. So we want to ask what the behavior looks like, the topography of it. So if parents say, well, he's aggressive, when you say aggressive, what does that look like? What is he engaging in? Is he hitting? Is he kicking? Is he punching, biting, pulling hair? We want to be as specific. That's going to give you a better idea of what the behavior looks like. And then talk about the antecedents with parents and ask them for an example. When was the most recent time that he engaged in kicking or scratching or pushing, whatever behavior they're talking about? And if they say it happened this morning, so ask them, okay, what happened right before he threw the water bottle at your head? Well, I asked him to put on his shoes. Okay, so you asked him to put on his shoes, he threw the water bottle at your head. What happened after he threw the water bottle? So you're already giving them that idea of, oh, something happened right before, and then he reacted, and this is the consequence. And let them know that's kind of what parent consultation will look like. They'll be asked those questions, and then they'll be taught the strategies to implement in order to reduce, decrease, hopefully extinguish those behaviors at one point. And then you ask questions about other areas of concern that they may have. Do they have concerns with social skills? Is their child social? Are they interested in playing or interacting with other children? Do they parallel play? Do they play cooperatively? Do they just isolate themselves and play independently? If they are playing, is it functional play? A lot of times parents don't think about these things. I'll ask, well, what is something they like to play? And they'll say trains. They love Thomas the Train, or they love cars and they play cars. And I ask, is it functional? Do they play fun? And they say yes. And then I observe the child playing with cars, and they're stimming off the cars the entire time. And I'll ask, oh, does he always do that? And then that's when parents say, yeah, they do. So a lot of the times this has become their norm. So they're not even aware that their child doesn't play functionally. So asking those questions is very, very important. Community and safety. Do they have concerns with community and safety? Does their child elope when they're out in the community? Do they understand danger? Do they understand stranger danger? Or are they going up to strangers and not respecting personal boundaries? Self-help. If the child is 12 years old, they should have the ability to independently bathe and dress and undress and be fully potty trained and put shoes, untie shoes. So can they do these things? Can they wash their face? Can they brush their teeth, wash their hands, brush their hair? And if not, those are areas that might be of concern, maybe not to parents, but to you it would possibly be an area of concern if the child is 12 and doesn't independently engage in any of those areas. You also want to ask about the child's background. Medical history, is there anything that's significant? Have they been hospitalized recently? Do they have a comorbid disorder? Is there something that we should know that would be important to know before beginning intervention? Are they on any medications? If so, what are the medications? How often are they on that medication? Do they take it twice a day, once a day? And the name of the medication. Allergies, I touched on this, talked about this a little bit earlier. Do they have allergies? If so, list the allergies. Hospitalization, again, have they been recently hospitalized? Have they had any services in the past? This includes occupational therapy, physical therapy, speech and language therapy, as well as ABA services. If they have, make sure that you list those services that they've had, how long they had them for, if they were discharged, why the services were terminated. A lot of the times parents will provide you that information. Oftentimes they don't. There are some questions that are more appropriate to ask than others. If parents say, yeah, they had ABA in the past, but the services stopped a year ago, you would then ask, were services terminated because the child met all of their goals? And they'll say yes or no. If they say no, we were discharged for other, that's fine, great. But you don't want to pry. You don't want to ask too many personal questions, right? Or make them feel like you're trying to get more than they want to tell you. And you don't really, doesn't matter what agency they came from. That's not something we need to ask. We just want to know were services terminated because they met the goals or for other reasons. If they want to tell you again why, that's great. If not, that's okay. Just so you can put this in your report. And any current services, sometimes there are families that are receiving services through the regional center and they're fading out soon, so that's why we're coming in. So if they do have services, you would write this in. I've had FBAs where this was exactly the situation. They were receiving services from the regional center, and it was more of a parent consult model and not really direct services, but I wrote that in the report. The family was receiving only parent consultation. The last day of services through a regional center would be, and then I would write the day. And school information. Is the child enrolled in school? If so, you want to write anything the parent tells you about that. Are they in elementary school, high school, pre-K, middle school? Are they mainstreamed? Is it a special day class the entire day? Do they have a one-on-one? So you would want to write that information here. And then milestones, developmental milestones. So did the child reach those developmental milestones at a typical age? Crawling, walking, sitting up, babbling. The kids that are nonverbal, a lot of the times parents would say no, they started to babble and then they stopped, or they didn't have their first word until they were 5. So those are things that you would want to write in your report, because again, you want to be as specific as you can so that the supervisor that's coming in to take on this case has a very clear understanding of the client. You want to discuss feeding and sleeping concerns. Is the child sleeping? A lot of the times our kids with ASD have a really difficult time sleeping through the night and often take medication. So if that is an area of concern, you want to write that down. For feeding, is the child a picky eater? Do they eat solids? Do they not eat solids? Do they have a difficulty time swallowing liquids or solids? Those are all things you want to know. Sleeping concerns. When I do have cases with sleeping concerns in kids who are on medication, I write both their sleeping patterns with and without medication. So I'll ask parents, with the medication, how many hours do they sleep? Without medication, how many hours are they sleeping? With feeding, if they have a difficult time swallowing solids, I would write has a specific diet due to, and you list all of those things. How does a child interact with peers? So this goes back to the social skills area. Do they parallel play? Do they cooperatively play? Do they just isolate themselves? Do they functionally play? And how do they do in the community? Again, we've already kind of gone over this. And you want to allow parents to talk and provide you with information that's relevant and important to include in the report. Again, oftentimes you're going to be out with families who have never had ABA before and who just recently received a diagnosis. They're going to want to vent often, and they want to talk about the way they feel. Again, redirect the conversation back to the assessment and back to relevant information. And you can do it in a way that's very nice. It's not like, oh, I can't talk about that with you, or I don't want to hear that, right? You don't want to be rude to them. But just redirect it back to the client and try to tie it back to an area that you're assessing. After you talk to parents about their concerns and reviewing the documents, you want to interact with the child in their natural environment for the first observation. So whether this is inside the home or outside in their backyard, but in the environment that they're most familiar with. And you're going to want to be taking notes on what the child is doing and what the child is not doing. You want to know things that are important. So you're looking at communication. Is the child verbal? Are they nonverbal? If they're nonverbal, do they approximate? Are they using PECs? Are they using any other kind of assistive technology, the iPad, ProLoQ, anything like that? Or what are they using to communicate? For play, again, are they playing independently? Is it functional? Are they playing cooperatively? Is it functional? Is it parallel play? And then also going back to communication, if they are verbal, are they communicating using 1 to 2 word utterances? Is it 3 to 5 word utterances? Those are things to know, because if you have a child that is 10 and is communicating using 1 to 2 words, there's a delay there. So those are things that you would want to know in your report. For behaviors, you're taking ABC data, you're operationally defining the behavior, and you're taking baseline. So whenever I'm out at FBAs, I write all of the possible behaviors that a child could possibly engage in during my observation. So I write out head banging, kicking, punching, biting, pulling hair, hand flapping, scripting, anything that I typically see, throwing, swiping, tantruming. And if the child engages in any of that, I tally, right? Because you want to make sure that you do provide a baseline, and you want to include that baseline in your FBA. So again, the supervisor that's taking over this case has an idea of, oh my gosh, this kid is headbanging 5 times an hour, or oh, he is eloping 2 times an hour into the street. Those are things that they would want to know. You're looking at their social skills. Are they making eye contact? Are they sharing? Are they taking turns? Are they engaging in conversation? Is their conversation appropriate? Can they stay on topic? Can they engage in a conversation that is not of their interest? And you want to identify strengths and weaknesses. So if you look at the packet, there is also a template for an FBA that we provided. And you'll see in the template, there is a section of strengths and weaknesses. And that area is broken up into learning, self-direction, self-care, independent living skills, receptive and expressive language, social skills, and play skills. So these are all things that you're going to be looking at. You're going to be assessing all of these areas when you're interacting with the child, and you want to note the strengths, the weaknesses. So under learning, what might be a strength? The child's able to sustain attention for 15 minutes. That's going to make his learning a lot easier than if he's only able to sustain attention for 30 seconds. With self-direction, can they self-direct? Can they independently engage in activities? If the child is stimming on the wheels of a car when he has nothing else to do, he's not self-directing. He's not engaging in something that's more age appropriate for him. When he isn't given instructions, or he's in a less structured setting. Self-care, independent living skills. This goes back to, is the child able to independently bathe, shower, if they are at an age that they should be able to do these things. And receptive and expressive language, again, are they verbal, are they nonverbal, how many utterances are they using to communicate? Social skills and play skills, are they isolating themselves, are they engaging with other peers, are they showing interest in interacting with others? Those are all areas that you want to look at and identify those strengths and those weaknesses. At the end of the first observation, you are going to schedule your next appointment and your next observation. So you're going to schedule your second observation with the family and let them know that the second observation can be at the school, in the community, so out at a park, supermarket, because often during the first observation, there have been times that I don't see any behaviors at all, and the child's just having a great day. And parents will say, well, we have a really, really difficult time when we go out to grocery shop. So we'll say, okay, let's do the second observation there. You go out, and sometimes it's completely different. The child's engaging in multiple behaviors. So if the parent wants you to go see them at the school, you would contact the school, but before contacting the school, the parent has to sign the release of information that they're provided during the first observation. So during the first observation, you want to say, if there's, if they do say, oh, I want you to go observe my child at the school, they would need to write the school's name on there, giving you permission to even contact the school. So if they do that, then you would contact the school, introduce yourself, let them know who you are, what you're calling about, and ask if you can come and observe. There are schools that love it when we come out, and there are schools that don't want us there at all. And we just have to respect that. So if they say you're not allowed to come, that's okay. Then call the parent back and say, unfortunately, I wasn't able to come out observe at the school, so let's set up our second observation either in the home or again out in the community somewhere. And if you are allowed to go to the school, it allows you to observe social interactions, which is always great. And again, you're completing the same steps that you're doing during your first observation. You're still taking ABC data, you're still tracking frequency for behaviors, you're still working on getting an accurate or most accurate baseline. So now after you've done the first and second observation, you write the report. Now that you are writing the report, you want to use that template that we provided to you. If you don't have the template again will be in the resource finder in the back with the trainings in there. And you want to write goals that are appropriate for the child. If you're having a difficult time writing goals, ask for help. Reach out to another supervisor, reach out to a BCBA, to one of the coordinators and say, hey, I have this FBA I'm working on and this is what the child is engaging in. These are some of his areas of strength and weakness. I'm having a really difficult time writing a goal for this area. Help me out. And everybody's always willing to help. So yeah, don't write a goal that you don't feel confident about. Make sure that you ask for help if you need it. One of the frequently asked questions is, how much time do you have to write the report? Typically, in the FBA authorization that Heather sends you initially, it'll have an authorization for the hours. The hours, that's the total amount of hours you have for both observations as well as writing the report. Typically, it's 8 hours, but there are some that have more hours. So 8 hours, it is possible. It is possible to do 2 observations and write the report. If your first observation is 2 hours, which it typically will be, and your second observation is an hour and a half or another 2 hours, which again typically will be, that still leaves you 4 to 4.5 hours to write the report. And it is possible, if you feel that you're not going to finish in 4 hours, reach out to Heather, let her know, hey, I need another hour to finish this report. And then if she approves that, you can bill for that additional hour. But typically they are. Something that helps me to manage my time is after the very first observation and after the second observation, I go home and I type those observations up, because then I don't have to try to go back and remember, a week or 2 weeks later what I saw, what I observed the first observation. So it's kind of good. And oftentimes after the first observation, you have somewhat of an idea of what behaviors you're going to focus on. And if that changes after the second one, it's just easy to go back and delete it off that document than it is to try to just remember. And after you write the report, you do a recommendation of hours for the client. And another commonly or frequently asked question is, how many hours do you recommend for a client? And for this, it's truly, you have to use your clinical judgment. And I've heard people say, well, I don't know if I have a very clear clinical judgment. Think about it this way. If you are conducting an FBA for a child that is 2, 3, 4 years old, that's still considered early intervention. Early intervention is up until the age of 6 typically, but the pivotal time is up until 3, right? So if you have a child in that age range, 2, 3, 4, 3.5, and they are at a lower cognitive level, and they're nonverbal, you're probably most likely going to recommend a lot more hours than you would recommend for a child who's 11 or 12 and is higher functioning and is only lacking maybe social skills and a few adaptive skills. And if you're unclear, again, just ask. If you say, I have this kid and he has multiple behaviors and the behaviors are of huge social significance and maybe it's extreme SIBs, you're going to be recommending more than 6 hours for that kid a week. And perhaps the team's going to need more supervision, so you're probably going to recommend more than 4 hours a month of supervision. So again, if you have questions, go to one of the coordinators or ask another supervisor about hours. Hey, I have this. How many hours would be appropriate? So that you know that child is really getting the hours that they need to make progress. And again, sometimes if you do make a recommendation for hours and the insurance doesn't approve it or doesn't authorize that many, you'll hear back. You'll get that feedback. After the report is done, you email that and you scan all of the signed documents and you send it back to Heather Cromaldi. So I typically use the Genius Scan app and do it that way and email it to her. And typically she gets back to you if there is any feedback, if she wants you to make any changes, or if she has any questions about your FBA, if she's unclear about something you wrote, it doesn't really make sense, she'll let you know. The insurance will get back, and also they'll give you feedback, and that's typically how it works. They'll get back to her and then she'll get back to you so that you can make those changes, and then you'll resubmit it to her to review again. And it's after that, it's just kind of a back and forth until the report is the best it can be so that it can be submitted to the insurance providers. If you guys have any questions, you can contact, again, either one of the coordinators or talk to Heather herself, or you can talk to another supervisor that you know has done a lot of FBAs and has more experience. That we're always willing to help. I'm always willing to help, and I have resources that I'm always willing to share. So if you do need help with something, feel free to come to one of us and we'd be more than happy to help you guys. So if you don't have any questions, we're going to wrap up. I'm going to be here for a little bit afterwards, so you can feel free to come ask any additional questions and I'd be happy to answer those. The template that I did provide to you guys, it's just a blank template. So if you have any questions on any of those areas and what you would write or what you would fill in, feel free to come ask those questions. I'd be free or more than happy to help you with those. Okay, thank you guys for coming.